I'm Marcel Salathe. I'm a professor in Switzerland at EPFL in Lausanne, and there I run a lab called the Digital Epidemiology Lab. So we use digital technology like apps to advance health research. So we are involved in the miGut project because we have developed an application for diet tracking, and given that diet is an essential component of IBD, that's why we were brought in. Yes, so the early versions of MyFoodRepo already had AI inside, but the AI at that time was, pretty good, but not good enough. So there always, whenever participants took a picture, the AI would take a first shot and then get it mostly right, but often not quite. So there had always had to be a human also checking the images so that the data would be of high quality. And that slowed, of course, everything down. Now, when ChatGPT came around and this new wave of AI models, we were able to completely bypass that step because all of a sudden the AI was just so good that it could actually do practically all of its work alone. When it would make occasionally a mistake, the user could just quickly correct that him or herself. And now one can even chat with the app and have a conversation about the data that the app has collected, which was just completely unimaginable just a few years ago. So interestingly for us, over time, the challenges have actually become less. That's usually not normally how things go, but here again, we've just been completely been a beneficiary of these massive AI developments in recent years, where it just allowed us to essentially remove a lot of the code we had developed previously and just replace it with calls to these AI models that are now offered by companies at prices that just really doesn't even register anymore. The prices have collapsed so much. So for us now, the biggest challenge is actually just rapidly integrating all the available food lists from around the world. But it's more of a pleasure than a challenge, I would say. So yeah, not a lot of challenges anymore, thankfully. We believe that food and diet, the community generally believes that the diet has, of course, a strong impact, and patients with IBD, of course, tell us that as well. Some even manage to manage IBD with relatively good results by changing their diets. But in terms of research, it's very hard to say what works and what doesn't, because the way we have collected dietary information in the past has been very rough with food frequency questionnaires and such things. And of course, people find it incredibly hard already to remember what they ate last night or the night before, let alone for an entire month. And now with apps like these that are super easy to use, they can really easily track what they eat and then also easily connect it to flares and other disease symptoms that they have. And for the researchers, it really allows them to have high quality, high resolution data to then analyze whatever they need to analyze in their cohorts. The biggest one that people normally have when they hear about it is this notion of having a discussion with an AI, right? This is outside even of MyFoodRepo, is a big ethical discussion. What does that mean? In the beginning, people are a bit hesitant, but as they realize this actually works quite well, they have less hesitation. We see that also in other studies. People increasingly, when you give people an option of, for example, a medical doctor and a medical AI chatbot, in the beginning, everybody thinks, of course, everybody would like to have the doctor, but it increasingly turns out that people also have a massive preference for the AI because the AI is always there. It always has time to explain everything forever, 100 times, 24/7. So it has a lot of patience, a lot of empathy. It gives very actionable advice. Of course, we need to make sure that that is also the correct advice, right? The quality has to be there, but with current AI, we feel pretty confident about that. So I would say there are now few really big ethical hurdles because these things, the data is collected completely anonymously also. So the AI model can't even connect a person to an image of a food. So that's really, yeah, I think it's the privacy preservation is quite strong. There's different parts. There is the app itself, which is something that's not easy to do because that requires some technical know-how that you don't necessarily find just easily at universities. So there we're also working with an external provider. But then, of course, the whole logic behind it, the backend, that's something that we are building and we have built over the years. Again, at the heart of that used to be the AI. Now we've taken essentially that part out and we're just taking off-the-shelf AI, which is very powerful. So a lot of technological development. And then we also actually use the app ourselves. That's something that I see often not being the case. I often see research projects building apps for patients, but the researchers are not patients, so they don't actually use the app. And then that can be very challenging because we all know if an app is not super easy to use, you basically stop using it very quickly. So I've been tracking my diet for over a year now, every day with this app. So if I see just a slight thing that I don't like, it will be eliminated, right? And many of my lab members are like that. So that's also actually an important part of the work. Yeah, I think it will completely change the game, frankly. And this is just the start because I do believe now, again, tracking the nutrition itself is largely a solved problem. But now I can, of course, then also as a next step, give the AI access to this data and say, look, I have the following health problem. What advice would you give me in terms of, for example, changing my diet? And then the AI could give me advice, and it could, of course, as I continue to track my nutrition, it could then also see whether I'm actually following this advice or not, whether it helps. So it can become really a personal coach that is, again, emphatic, always there, is reading the entire scientific literature, right? Also because that's what these models do. And at the moment, I'm seeing still a bit of resistance against that vision because it's also a completely revolutionary vision, not only for my food but just in general. But I'm fairly convinced that this is where the future is, and we will all have our health assistants in our pockets in the coming years.